what about TSH elevation? TSH.
TSH. The same question, thyroid problems. The thyroid problems are very simple. It's all connected to your milk and the steroidal imbalance. And so if you stop milk, your TSH starts getting corrected. And if you stop coffee, tea, it gets easier. Much is something. This is what I said. Early, no, 1 cup of coffee. That's enough. No, you just need to stop completely. But then it's still, without all these troubles, we have a protocol for thyroid patients. You need to eat little millet 3 days and the remaining 4. Kannadadalli. Little millet is called sama. Samalu, Telugu. Okay? We eat little millet 3 days. I'll just finish the protocol. 3 days of little millet, remaining 4 millets each day, 1, 7-day cycle. And then I didn't speak much about oils. Maybe you have listened to my lectures. Oils, coconut milk, coconut oil is very good. So early in the morning, but we have been brainwashed that oils are bad for you. The coconut oil, cholesterol, groundnut oil is not good for you. Only everyone has to eat olive oil. Where is the olive tree? The whole world wants to eat olive oil. Nonsense. It's all business. And there is no olive oil there. It's all the all diesel mineral oils they are filling up and then making us believe that you have sun pure sunflower oil, sun pure rice bran oil, sun pure this oil, that oil. There is no real oils there. The real oils are wherever you are living, that area produces some oily materials like coconut, tillo, groundnut, safflower, and then Niger seeds. All these are oily materials that you have. And coconut oil and till oil, alternate weeks you drink 2 to 3 spoons, your thyroid gets cleaned up. Because many of these glands are made of fat material. So you have to clean them up with fat only, because the kalmashas that are stuck there can be cleaned with only fat, because the fat soluble, water soluble. So water soluble things anyway gets cleaned up, but then fat soluble kalmashas, the toxins have to be cleaned with fat only. So early in the morning when your body is empty, you drink 2 to 3 spoons of coconut oil 1 week, the next week till oil, next week groundnut oil. Then within 9 weeks, your system gets corrected. Most of the patients, thyroid patients, start seeing the corrections happening. Even if actually I have many patients with TSH 150. In 9 weeks it comes to 50. The next 9 weeks it comes to 40. Then as the things come down, it takes more time. So generally 6 months to 2 years, almost every thyroid patient corrects himself or herself. Absolutely no problems at all. Yeah, thyroxine, L-troxin. And this is a good question. Not only thyroxine, L-troxin, lot of people, SLE people, multiple sclerosis, they're all addicted to steroids. And to remove steroids, it is very tough. Though it doesn't do any help, but to get de-addicted is a big problem because we are all used to them, the chemicals. So the simple thing to do is, every 6 weeks, you remove 25%. Say now you are taking 10 milligrams of Isolone, that is regular steroid tablets that are given for many immunity problems like autoimmune diseases. So 10 milligrams of Isolone you are taking today, 10 tomorrow, and then 10 next day. So what you need to do is take 10 milligrams today, take 5 milligrams tomorrow, take 10 milligrams day after tomorrow, take 5 milligrams. So you have reduced out of 20 milligrams per 2 days, you are now taking 15 milligrams. So after 3 or 4 weeks, now you take 5 milligrams, 5 milligrams, 5 milligrams, 5 milligrams. Now we have got to 50% in next 4 weeks. And then again, instead of 5 milligrams and 5 milligrams, take 2.5 milligrams, 5 milligrams, 2.5 milligrams. So slowly and steadily, every 3 weeks, you keep reducing 25%. Over a period of 6 months, you will get rid of your tablets out of your body. Whether it is diabetes, whether it is cancer, whether it is SLE, whether it is anything. In fact, nowadays for everything people take, migraine headache every day. In fact, they have gande barutte. If you don't take cetirizine, you will start scratching your body all over. If you just touch something, now I touched accidentally, that little pressure creates autoimmune shock. And then I start creating gande and start creating. Or some fellows start sneezing. Some fellows starts getting headache. So all these problems, people are addicted to some tablet or the other. And the way to get out of it is this particular fashion. And some people actually have taken so much tablets that for them it doesn't matter. So they leave everything. In fact, this has happened for a blood cancer girl, 16-year-old. Every 3 days they were injecting the hemoglobin because blood kodtane irbeku, it keeps degenerating. And they were giving medicines also. Each time they give, they had to give 10,000 rupees tablet for a month. So at the end of the day, they lost their money. I mean, they don't have enough money. So they gave up. They stopped totally, all at a sudden, because they don't have money. Then they followed this blood cancer protocol. Within 6 days, her blood started stabilizing. In 6 weeks, they didn't need to give her transfusion of the blood. 6 months later, she appeared in my house. She is from Kakinada. So she was not able to get up from the bed. And now after 6 months, they just brought her to thank me. I said, I cannot see you. He said, no, don't see me because I am tightly scheduled. We just wanted to thank you. Like that, almost every day for me, 10 people come. We don't want your appointment. We just want to thank you. So that's the kind of situation that exists now. And you can come out of these diseases. You don't need any doctor, basically. Already they have given you enough tablets. They cannot do more. So you need to come out of that. Just come out of it slowly and steadily, because the de-addiction process can create shocks in your body. So do it slowly, sir.
And dandruff, other things. Doctor recommends vitamin E and other sort of tablets.
Yeah, that's what I said. No vitamins are absorbed by the body. First half of my session is that only. So you want to include that vitamin E in your food. So you figure out what food has your vitamin E, and actually that table we have got skin diseases, what to eat, what kashayams to drink. So all that job is done. You just have to go to that particular table, figure out what you need to eat, you can eat. No, I want to eliminate my clinic. And that, so you want to come to clinic, don't come to clinics. It's not